Hi everyone, my name is Diksha Dakal. I am a nursing student at Western Sydney University at Hawkesbury campus, and my student ID is 2220164. I have my ID right there. And today I'll be presenting my presentation for Health Variation 1, and my chosen topic is breast cancer, a post-operative nursing management following a modified radical mastectomy. Firstly, introducing my patient, she is Amara, a 44-year-old female presented to the ward after a right-sided modified radical mastectomy. She was diagnosed with stage 3 invasive ductal carcinoma with no known family history, but since diagnosis has undergone genetic testing and genetic counseling, which has confirmed BRCA mutation, she has two wound drains in position. She has reported pain like pins and needles in her right axillary region. Understanding about pathophysiology of breast cancer. Amara's breast cancer developed when abnormal cells within the right breast tissue began to grow and divide uncontrollably, most likely originating in the ducts of the breast. These abnormal cells formed a tumor due to genetic mutation that disrupted normal cell regulation and apoptosis, which is cell death. Over time, the malignant shield divided surrounding breast tissue and spread to axillary lymph nodes, resulting in stage 3 invasive ductal carcinoma. Due to the extent of discharge spread, Mara required neoadjuvant chemotherapy followed by right-sided modified radical mastectomy. The cancer progression and lymph node involvement increase the risk of impaired lymphatic drainage and further complications such as lymphedema. Although some patients develop adaptive remodeling with formation of alternative superficial and deep lymphatic connection to maintain drainage, failure of this mechanism can result in lymphedema and associated functional impairment of the upper limb. Moving on to risk factor. Amara faces elevated risk due to having axillary node dissection, currently having post-operative wound drains, and reporting altered sensations such as pins and needles in the armpit, signs that early lymphatic and nerve disruption is already present. Additional risks identified in her history include her BRCA1 gene mutation, which significantly increases susceptibility to breast cancer, female sex, and increasing age, as hormonal exposure over time contributes to breast cancer development. Furthermore, axillary surgery and pre and post-operative pain burden, all of which place Amara at heightened risk of developing lymphatic dysfunction, affecting her recovery, mobility, and ability to care for her children and return to her active lifestyle. There are mainly two types of nursing intervention. They are pharmacological and non-pharmacological intervention. One priority nursing intervention for Amara is an administering prescribed medicine analgesia such as paracetamol, NSAID, and stronger pain relief if required for following her right-sided modified radical mastectomy. She reported pins and needles in her axilla, suggesting nerve irritation from axillary surgery. Effective pain management improves comfort and supports breathing, movement, and recovery. NSW Health recommends a regular pain relief after breast surgery to assist healing and enable participation in post-operative care activities. This intervention is pharmacological intervention. And key non-pharmacological intervention is encouraging deep breathing exercise, arm exercises, gentle mobilization, and a healthy recommended as recommended by NSW Health. Deep breathing exercises help expand lungs after anesthetic and reduce respiratory complications. Arm exercises prevent stiffness and frozen shoulders, especially with symptoms like pain and tingling that may discourage movement. Gentle walking supports circulation and reduces DVT risks. A diet rich in protein, iron, and fiber supports healing, recovery, and bowel functions, as constipation may occur due to reduced mobility and pain medication. Further, explaining about post-operation, I will be mainly covering wound care, wound drain monitoring, and therapeutic support. A nursing intervention for Amara is ongoing assessment for her surgical wound and the two wound drains following her right-sided modified radical mastectomy. Nursing care should include monitoring vital signs, assessing drains output and color, inspecting the dressing for bleeding or signs of infection, and ensuring the drains remain patent. This is important because Amara underwent extensive axillary surgery for stage 3 invasive ductal carcinoma, increasing her risk of fluid accumulation, delayed healing, and infection. NSW Health states that post-operative breast surgery patients require regular wound observation and that dressings are gently left intact unless saturated or causing irritation, with breast care nurses providing follow-up education and support. Another priority nursing intervention is provided therapeutic communication and education about post-operative recovery, including wound care, drain management, and recognizing complications. Amara may experience emotional distress related to her cancer diagnosis, PRCA1 mutation, altered body image, and responsibility as mother of four. First and the team 2024 found that women recovering from mastectomy valued emotional support and compassionate nursing care alongside clinical management, as recovery was described as both physically and emotionally challenging. Educating Amara about her dreams and protecting the surgical site when to seek help and improve confidence, reduce anxiety, and support holistic recovery. Moving into patient education and discharge preparation and multidisciplinary support, Amara's discharge education should include wound drain management, pain control, and access to appropriate support services following her right-sided modified radical mastectomy. She should be reassured that it is common to feel low and emotionally affected after surgery, and she should be encouraged to contact breast care nurses for her surgeon practice during hours, for support to attend the emergency department after hours if urgent concern arises by NSW Health. Education should also emphasize the importance of taking prescribed analgesia to support comfort, breathing, and mobility, as well as following instructions for wound and drain care provided to the discharge. Multidisciplinary support is also essential for Amara's recovery. BCNA highlights that breast cancer care is best managed through a coordinated multidisciplinary team, including breast care nurses, surgeon, oncologists, and allied health professionals such as physiotherapists and psychologists to support physical recovery, rehabilitation, and emotional well-being. First and the Team 2024 further emphasized that women recovering from mastectomy value not only clinical care but also therapeutic communication and emotional support, reinforcing importance of ongoing access to breast care nurses during recovery. At last is my references where I got the information for this presentation. Thank you so much for watching and hope you enjoyed my presentation. Hope it was educational and I covered the topic. Thank you.